Alright, so this is the sequence in which these 6 ossification center will appear around the elbow and they will appear on the x-rays. Now, how to remember this? How to remember the sequence? You know, capitulum will appear at 2 years of age, while radial head will appear at 4 years of age, medial epicondyle 6 years of age, trochlea at 8, olecranon at 10, while lateral epicondyle at 12 to 14 years of age. Now, it is not very difficult. It is just the table of 2 that you have written. But the important is you have to remember the sequence on the opposite side. That means how will you remember that capitulum is the first to get ossified and will appear on the x-ray at that particular age group. So, you know, there is a mnemonic which is CRITOE, like this. CRITOE. C means capitulum, R for radial head, I for internal, that means medial epicondyle, T for trochlea, O for olecranon, E for external, that means the lateral epicondyle. Alright, so CRITOE is considered to be the mnemonic for the particular. So this is mnemonic, but what you have to remember is the age group at which they will appear on the x-ray, and this is the exact sequence. So it is not like that exactly at 2 years of age, it could be 1 to 3 years of age. Similarly, for radial head, it is going to be like 3 to 4 or 4.5 years of age. Similarly, for medial epicondyle, it is going to be around 5 to 6 years of age. So this is the real age group that these secondary ossification centers will appear around the elbow. Alright, so this is another anatomical perspective. So first we talked about what are the names of the bones. Second, we have talked about the ossification centers and the age of appearance of these ossification centers on the x-rays. Alright, so the next topic is carrying angle. Now, you know, importance of the carrying angle is that just try to understand, if you look at your own arm and the forearm and what is the relation in between the two, then you will conclude that this is the long axis of the arm and this is the long axis of the forearm, and both of them are not inclined in a same line. Just try to understand. If I give you the example in a rough diagrammatic representation, if this is the trunk of the individual, alright, this is the trunk of the individual and this is the arm of the individual, and here there is a forearm of the individual and this is the hand. Now, if you look at the long axis of this arm and forearm, this is the long axis of the arm and this is the long axis of the forearm. So they are not the same line. There is an angle in between the two, and this normal angle, this is considered to be the normal angulation in between the axis of the arm and the forearm. In order to have an increased reach laterally, in the body, there is a provision of this carrying angle. Alright. So this is the normal carrying angle over here. Now, how you will come to know that what is the exact value of this carrying angle? You know, although there is a range that it is considered that the normal carrying angle is somewhere around 7 to 13 degrees. But it is not like that if the patient is having 9 degree, then on the right side, then there has to be a 9 degree on the left side, then it is considered to be normal. How abnormality is gained? For example, the patient is having 9 degree on one side, but 11 degree on the other side, which is because of the trauma, although it comes under the normal category, but it is considered to be slightly abnormal. But yes, if the things goes beyond these 2 degrees, then it would be having a abnormality. So first of all, if you look at these images again, then what you have found over here is that this is the normal elbow, because here we are having the long axis of the humerus or long axis of the arm and the long axis of the forearm, and there is a creation of the carrying angle which is within normal limits. But what is happening in the two abnormalities associated with this carrying angle? If you look here, then this is the long axis of the arm and this is the long axis of the forearm, and the apex this deformity is creating is actually pointing away from the body. Alright, it is pointing away from the body. That means the forearm is inclined towards the human body. So it is considered to be the varus angulation. Now this is for the first time you are getting introduced to these lateral deviations of the joints, that means varus or valgus abnormality. So how you will conclude that whether it is varus or not? Just try to take it with the example or learn it with the example. Imagine this is the trunk of the individual. Alright, this is the arm of the individual, and here we are having a forearm. So if you look at this image, if you look at the axis of the two, this is the long axis of the arm, this is the long axis of the forearm, and here the apex which is being created is pointing away from the body. That means the forearm is directed towards the human body. So it comes under the category of varus angulation. So this abnormality is varus. Similarly, if you look again on the another abnormality, like here, what is happening? This is the long axis of the arm and this is the long axis of the forearm, and the apex it is creating is pointing towards the body. Alright. So it is considered to be normal, because in case of normal carrying angle also, the apex is pointing towards the human body. But here, it is slightly greater than the normal one, or the value of this angle is greater than the normal. So it is again considered to be the abnormality. So when the apex is abnormally pointing towards the body, or when the forearm is deviated abnormally lateral in relation to the midline of the body, this lateral angular deformity is considered as valgus. Alright, so here for the first time you got introduced to these two lateral angular deformities in the human body. One is varus, where the apex is pointing away from the midline of the human body, and the other one is valgus, where there is excessive apical angulation towards the human body. Alright, now both these two things, because they are happening at the level of elbow, and the word is cubitus, which is used for the elbow. So one, if the patient is presenting with this kind of a deformity at the level of the elbow, you call it as cubitus varus. While if the patient is presenting with another sort of deformity, you call it as cubitus valgus deformity. Alright. So carrying angle is a normal anatomical perspective associated to deformities related to this carrying angle. One is cubitus varus and other one is cubitus valgus, which we will come to know in a recent sessions. Alright. Now 3 bony point relationship, or the 3 bony point landmarks. So you can also write the word relation, like these are the 3 bony point, and what is the relation of these 3 bony points to each other. Alright. First of all, what are those 3 bony points? The 3 bony points are 1, 2 and the third one, that is tip of the olecranon. So the first one is medial epicondyle. Then the second one is the lateral epicondyle. And the third one is the tip of the olecranon. Alright, first of all, you came to know what these 3 bony points are. Point number 2, what is the relation in between the two? Now you can palpate your 3 bony points. This is medial epicondyle, this is lateral epicondyle, and this is the olecranon process. Now, what is the normal relation in between these 3? So normally what happens is that in extended, means when the elbow joint is extended, all the 3 bony points are creating a single line. Like for example, here we are having an extended elbow, this medial epicondyle, this tip of the olecranon, as well as the lateral epicondyle, all of them are having, or all of them are lying in a straight line. So this is what the 3 bony point relationship is in case of a normal extended elbow. So in extension, they are creating a straight line. All of them are falling in a straight line. While in flexion, now suppose if you are flexing the joint in 90 degrees. So within 90 degree flexion, what happens? When you flex the elbow to 90 degree, you will find that all these 3 bony points are creating a isosceles triangle. Now here what is happening? This is the medial epicondyle, this is the lateral epicondyle, and this is the tip of the olecranon. So here they are creating a isosceles triangle. So in 90 degree flexion, they are creating a isosceles triangle. Alright, so this is the normal relationship in the elbow of these 3 bony points. Anything which is abnormal in relation to this is going to be a clinical finding. Like if the patient is presenting with the non-union lateral condylar fracture, he is going to have a abnormal 3 bony point relationship. If the patient is presenting with intercondylar fracture, if the patient is presenting with medial or the olecranon fracture, he is going to have a abnormal 3 point bony relationship. Alright. So you should first of all be aware of that what is normal, then we will talk about the abnormality later. Alright. So hope everything is clear related to this elbow anatomy. So if we revise this again very quickly, what we have talked about, the first one is that what are the names of the bones which are visible on the X-ray, what are the bony landmarks that you can see on the X-ray. Second is that how the secondary ossification centers, what is the sequence of appearance in the elbow joint, and what is the age at which they will appear on the X-rays we have talked about. The third point is the carrying angle, the normal thing and the abnormality we have talked about, and in the subsequent lectures we will come to know that, subsequently we will come to know that how significant this abnormalities in the carrying angles are, and finally we have talked about the 3 bony point relationship around the elbow. Alright, and how this clinically is going to define whether you are having or the patient is having a normal or the abnormal elbow.